Into a new year, but the pandemic continues on, and we are delighted to say that our friend Dr. Dennis Norem from Mercy Health has agreed to join us here in the new year to continue our ongoing discussions of COVID-19 and where we sit and how everything's going. Dr. Norem, good morning to you.
Good morning to you guys, and Happy New Year.
Happy New Year.
This New Year is better than the last one.
Well, tough to be worse.
Careful.
Okay, all right.
Careful.
All right.
One never knows. Well, let's just on a broad overview. Dr. Norm, do you feel this will be a better year as far as this pandemic goes?
Oh, absolutely. I think the hope on the horizon is we are starting vaccinations. I know I get my second shot on Wednesday, which is very reassuring, and hopefully we can get it out to the next level of people on the list and get people immunized over the next several months.
Well, let's just hop right into it then. You brought it up. You're getting your second shot here. I saw a couple stories over the last week or so, maybe pontificating on the fact that we need to extend the date between these first two shots. Have you heard about that? Do you have any thoughts?
Yes, there's a lot of discussion about that. I think they've announced in England that they're going to extend the date between the shots to try to get more people immunized. The other proposal is, which I just saw last night, is to give half the dose of one of the shots, the Moderna shot. Somebody's proposing that we only give half a dose, and that way we could double the number of people. I'm hesitant to recommend that. You really need to follow what the science says, and the science is based on what the studies used for dosing. And to deviate from that really concerns me that we would not be as effective. You know, if there was science to support it, wonderful. But at this point, I don't think we have the science.
So just to be clear, is the thought process behind, delaying that second shot, not to make it more effective, but to open the door for more people to get the first shot before everyone else gets their second one? Is that the thought process?
Yes, the two proposals. One is to delay the second shot, I think, up to 3 months instead of the 3 to 4 weeks. That way you could get more people immunized with their first shot, because the studies do show, at least with, I believe, both Pfizer and Moderna, that the first shot gives you about 50% effectiveness, and the second shot gets you up into the 90%. So that way you could get a lot more people at least started on their immunity. And then the other proposal, giving half the dose, obviously you double the number of people that you could immunize. But again, we don't have good solid science that says that that's going to be as effective as what we had seen from the original studies.
Okay. It's, once again, go along with what the recommendations are. You're going to see things that say, yeah, okay, let's delay, let's not delay. But as it stands right now, this is the best possible practice that a bunch of people looking at the raw data have come up with. Is that fair to say?
I think that's fair to say. And the concern is that we see this in I think, all kinds of situations when we have studies. Studies are very rigid. They are very careful about how they do things. And once you roll it out in the real world, it's not as easy to follow even the recommendations from a study. For instance, this recommendation that we get it at 3 weeks, well, I think we're going to do pretty well with that. But we saw with other vaccines, such as the shingles vaccine, that people were supposed to get it between 2 and 6 months. And when it was rolled out, a lot of people didn't get it within that time frame because we ran out of vaccine. My point is that the studies, we try to follow the studies, but when you get in the real world, it's even difficult to follow the study recommendations, let alone try to make modifications.
I'm looking at a piece here talking about Great Britain and the Oxford AstraZeneca vaccine. In a shift from practices, it says here from the Associated Press, in the U.S. and elsewhere, Britain now plans to give people second doses of both vaccines within 12 weeks of the first shot, rather than within 21 days, like we talked about, to accelerate immunizations across as many people as quickly as possible. Their chief medical officer, Jonathan Van Tam, said yesterday this is the right thing to do for the nation as a whole, but does not necessarily believe it's the right thing to do for all nations as a whole.
Yes, I think he's kind of hedging his bets because he knows that I think most people in the epidemiologic world are going to be critical of this idea of stretching out that second dose. Again, you're kind of rolling the dice. Yes, you immunize more people and you hope that the first dose does well in terms of immunity, but according to the studies, you need both doses, and the sooner you get the second dose, the better your individual immunity is going to be. So I don't see us in the United States doing that unless somebody can come up with some good scientific data to suggest that that's effective.
I don't think anybody really believed that we were going to roll out as many inoculations by the end of the year as Operation Warp Speed had predicted or called for. But it seems to be falling way behind that number. And you hear, some cities talking about it's going to take us 10 years to get everybody vaccinated at this pace. Was this expected, the initial rollout, maybe to have a little bit of stumbling blocks? What are the stumbling blocks? And have you guys had any impedance in getting your vaccines out where you work?
We have not. As I said, we received our vaccines within, I think, a few days of when they were shipped to the health system and distributed to the other health systems. And we are on track to get our second dose. I think it was probably to be expected that there would be stumbling blocks. Unfortunately, as we've mentioned in the past, we don't have a good public health structure to distribute these vaccines. And the vaccine distribution was really left up to the states. Operation Warp Speed was to get the vaccines transported to the states, and the states have made decisions on how they're going to administer the vaccines, and they're kind of all over the place. As you may have seen in Florida, people were lined up overnight because they announced that they were going to give the vaccine, and it was first come, first serve. Mm-hmm. So people were in cars for hours. I mean, that's just crazy. And what would you expect when you make an announcement, come to a certain site, first come, first serve, and line up whenever you want.
It's like getting an iPhone.
Yeah. Well, it used to be, concert tickets.
Right. I was going to say, you and I have a certain age group. Yeah, that's camping out for concert tickets right there.
Okay.
My wife did that a couple of times for, I think, New Kids on the Block for our daughter.
Very nice.
But I looked at that and said, that's just crazy. You have these criteria about who should get immunized first, and you would think that we could create a distribution system to get it to the people who need it first, and not just have this willy-nilly, well, one state decided to do this, and one locality decided to do something different, and then you find that some luxury high-rise in one state, all their residents apparently got immunized, whereas other areas, nobody's gotten the vaccine. So you probably would have expected this was going to be a problem.
Oh, absolutely. And we're also hearing cases of where there's been healthcare workers who've gone into the cooler and helped themselves and decided to sell a couple of these vaccines on the side. Not the smartest business move from what I've been able to ascertain. The federal authorities wanted to have a talk with that person and the others involved very quickly after that.
Oh, absolutely. And then the crazy guy went up in Wisconsin and decided to destroy it, let it sit out on the counter on purpose. And I can't imagine what his motivation was.
No,
hopefully those are exceptions, and most people will be honest and straightforward about administering the vaccine.
We were talking a little bit about studies. Another one that I think is kind of an eye-opener, because this has been an ongoing debate since the pandemic started. Should schools remain open? A study out of Mississippi suggests students who have tested positive for the virus might not necessarily have contracted it in their classroom. Bottom line of their study, kids more likely to be infected by a family member who does not take proper safety measures than they will at school, because kids have a lower rate of infection and transmission. This is a study led by the University of Mississippi Medical Center in collaboration with the CDC, saying kids are more at risk from contracting COVID-19 at a holiday party or a family gathering than they are from being in the classroom or in child care.
I think that makes sense. We've learned that family gatherings are really one of the major areas that people contract COVID-19. And schools, like other institutions, like where I work, where you mask and you sanitize your hands and people social distance as best you can, even though you're in contact with people, I think the transmission rates are fairly low. But obviously in our homes, how careful are we? We don't mask in our homes. We just assume that everybody is okay. And you're dealing with a lot of areas where there are multiple people in and out of a person's home. So I think it's to be expected that you're more likely to contract that in your home than you are in school.
So the other big wrinkle in coronavirus the last couple of days was the new strain or the mutation that's coming over from, I think, England was where they found it first. What do you know about that?
Well, I think that was to be expected. We know these viruses mutate, and it was not unexpected that we would find that at some point the virus would mutate a little more aggressive virus. We've seen this with flu viruses, where we start to develop a little immunity to some flu viruses, and then a new one kind of mutates and it becomes more aggressive. The good news is it appears to make people no more sick than the existing strain, and hopefully it appears that the vaccine is just as effective now. They're looking at that, so we don't have a final opinion on that, but I think we're going to find that we're going to be okay. I think the big concern is if this virus were to mutate into a resistant virus, that would be a problem.
Yeah, that's a real huge problem right there. The Moderna COVID-19 vaccine, according to what I'm looking at here, let's see, from a couple of days back, 94% effective, according to some of the testing that they have done on this one. Starting well back in July, when participants either got two 100 microgram doses of a potential vaccine or 2 shots of a placebo. And and apparently it's coming back at a 94 plus percentage rate of being effective. So that will be used in conjunction with the first vaccine that came out. And there's still a third one in the wings, right?
Well, I think the AstraZeneca one is waiting for approval here in the United States, and I don't know what the timeline is for that. There may be a little hurdle there. As we mentioned in the past, they had some problems with their study in that they inadvertently gave people half a dose. I think 5,000 participants got only half a dose the first time around, and they threw that into the mix. But it'll be interesting to see how our approval mechanism here in the United States, if they think that's a problem. Whereas in England, they went ahead and obviously approved it.
And one last thing before we get you out of here, going back to the vaccines, one of the headlines I saw was, so grandma's now vaccinated. Is it all right for her to, live life as normal? How safe should people feel once they do get vaccinated?
I think they should feel reassured, but I think I would remind people and make sure that they continue to do the kinds of things they're already doing. The one thing that we don't know yet, which we think is true but we haven't proven, is having the vaccine reduces your risk of contracting the disease. Does it decrease the ability for the virus to spread in a population? That hasn't been shown yet. So we need to continue to be vigilant, mask, social distance, until we really have enough people vaccinated and we have good evidence that we've slowed the spread as much as we can.
So essentially, what you're saying, we might have the same problem with vaccinated people as we did earlier, or still do probably, with the asymptomatic people. You're still a carrier, can still spread, but you're not actually getting sick.
Yes, absolutely. That is the concern. Again, in looking at other viruses, we think with flu and other things that, being vaccinated and we not getting the virus, we've really stopped the spread. However, we haven't shown that with COVID-19 yet.
All right. So, keep doing what you're doing. Keep the hands washed. Throw all the stuff on. Keep yourself distanced. All the stuff that's gotten you through thus far, whether that's hunkering down at home or wrapping yourself in saran wrap and going out. Whatever's been working so far until we get you lined up for that vaccine. Dr. Norem, as always, we appreciate the time. We appreciate the expertise. We're glad to have you into the new year, although we wish the pandemic weren't with us in the new year. We're glad you're here alongside us, guiding us through this.
I appreciate that, guys, and I'll stick with you until this thing is under control. Now, at some point, I probably get too old for that, but hopefully it won't take that many years.
You're not the only one. Dr. Norem, thanks. Have a great day. We appreciate it.